Akshita Agarwal, and on behalf of Anand Bajaj Retina Institute, ILV Prasad Eye Institute, Hyderabad, I'll be presenting results on our retrospective cohort study on clinical and imaging features with treatment outcomes of myopic CNVM in pediatric eye. So, myopic CNVM is a rare complication of pathological myopia in pediatric patients. It causes central vision loss, and it has been found that the prevalence of myopic CNVM in patients of pathological myopia is near to 5 to 11%. The aim of our study was to describe the clinical and imaging features of myopic CNVM in pediatric patients, that is less than 18 years, and to evaluate the treatment outcome of myopic CNVM using anti-VEGF therapy. It was a retrospective cohort study done at LVPI Hyderabad between January 2014 to December 2023, and ethics clearance was taken from the Institutional Ethics Committee. 9 pediatric patients diagnosed with myopic CNVM were included, and total of 10 eyes were included. So the inclusion criteria included the patients who had high quality SD-OCT images along with fundus fluorescein angiography and age of less than 18 years. The eyes that had media opacities, lacquer crack with macular bleeds were excluded from the study. The Snellen's visual acuity was converted to logMAR for statistical evaluation. The parameters that we studied on the OCT imaging were intraretinal fluid, subretinal hemorrhage, subretinal fluid, sub-RP hemorrhage and fluid, external limiting membrane discontinuity, inner segment, outer segment disruption, and any scarring that was noted. So for the statistical analysis, the continuous variables were presented as mean and standard deviation. The Snellen's visual data was converted to logMAR for statistical analysis. The male prevalence was found, and 60% of the patients were, 60% of the eyes were right eye and 40% were left eye. The mean age that was noted was 15.8 years with standard deviation of 1.7. The refractive error that was noted was minus 14 diopters with standard deviation of 5 diopters. The axial length which was noted in 7 eyes was 28.53 mm plus minus 2.7 mm. The logMAR visual acuity, mean logMAR visual acuity at baseline was noted to be 0.61 plus minus 0.44. The features that were other than myopic CNVM that were noted in these patients were posterior stephyloma noted in 1 eye. The chorioretinal atrophy sparing the macula was noted in 2 eyes. The location of CNVM was mainly fovea. The activity was noted at presentation in about 80% of the eyes, and inactive CNVM was noted in 20% of the eyes. The FFA feature was that there was classic leakage pattern in all the eyes. The scarring was noted at baseline in about 4% of the patients. Intraretinal fluid was present in about 24% of the patients. There was no eye having the subretinal fluid. The subretinal hemorrhage was noted in 28% of the eyes. The external limiting membrane discontinuity was noted in 10%, and ISOS junction disruption was noted in 24% of the eyes. So post-treatment, the visual acuity deteriorated in our study to 0.74 plus minus 0.55. The mean time to achieve inactivity following treatment was about 3.9 months. The average number of injections that were received were 3. So it was noted that the eyes that achieved inactivity following treatment were about 50%, and the eyes that showed the stability were about 28%, and 22 eyes showed that there was scarring following treatment. So in conclusion, that the previous studies, the IRIS study, that is Intelligent Research in Sight Registry study, noted that the prevalence was 18.4% in their study, whereas in our it was about 18%. The previous study showed that there was female predilection, whereas in our study it was male. And also it was seen that the volume of the subretinal fluid and the subretinal hemorrhage is less in myopic CNVM as compared to the CNVM seen in ARMD patients. So there was a significant improvement in visual acuity post anti-VEGF injections as compared to the patients who did not receive any injection and were followed without treatment. The theories behind the myopic CNVM is that there is axial elongation which causes the retinal and the choroidal stretching. leading to ischemia and anti-VEGF overproduction. The other connective tissue disorders like Marfan's and Ehlers-Danlos also have collagen deficiency and reduced ocular rigidity, which leads to more predilection towards CNVN formation. The significance of our study was to detail the prevalence, clinical and imaging findings of pediatric myopic CNVM, and it highlights the unique features and outcome of myopic CNVM in children as compared to adults. It had limitations as well, which included that there was limited access to the information of the connective tissue disorders, if any, in these patients. Thank you.
One question I would like to ask you is that you had practically the same prevalence between, but then in male and female preponderance, you had female and the other studies are male. How do you explain this? See, if your incidence as per other studies was same, that means you had used the same parameters to study that, but when you try to tabulate it, more females got than the males. How do you explain this?
In our study, actually, it was the males who were having more. So, because of the limited incidence and the prevalence of...
Did you get my question?
Yeah, as compared to the other studies,
why there is this discrepancy in preponderance in male or female? We have to give some answers to this. Now, ultimately, when you review the literature, your job is to understand why a particular thing is coming.
So that gender difference that has come, so there is no, in review of literature, I could not find any reason why it should be more prevalent in male or it should be more prevalent in female. So maybe that is just an incidental finding.
You could have found the correlation, like
correlation,
certain things.
age,
correlation with axil length, correlation with certain other features,
like subgroup analysis.
The subgroup analysis was more important. Anyway.